Ang susunod na programa ay rated PG. Ito ay nangangailangan ng patnubay at gabay ng magulang para sa mga batang manonood.
Warning. The following content may contain elements that are not suitable for some audiences. Viewer discretion is advised.
Ebola virus disease. What is Ebola virus disease? Ebola virus disease, EVD, is a rare but a serious disease caused by infection of the Ebola virus. There are 5 known strains of virus. 4 of them affect people. One affects only non-human primates, monkeys, gorillas, and chimpanzees and pigs. EVD was first identified in 1976 near the Ebola River in the Democratic Republic of Congo, formerly Zaire. In 2014, large outbreaks occurred in the West African countries of Liberia, Sierra Leone, and Guinea. According to the Centers for Disease Control and Prevention (CDC), there were 4 cases in the United States. 11 people were treated and 1 person died. Since then, several ongoing cases have been reported in the Democratic Republic of Congo. Symptoms of Ebola virus disease. Symptoms of EVD often begin 8 to 10 days after a person is infected within the virus. The virus cannot spread to another person until symptoms appear. Early symptoms can include fatigue, fever, muscle pain, headache, sore throat, weakness. Later symptoms can include nausea, diarrhea, stomach pain, unexplained bruising or bleeding such as bloody nose, bloodshot, eyes, or bloody urine or diarrhea. What cause of Ebola virus disease? The exact cause of EVD is unknown. Scientists believe that it is an animal-borne and most likely comes from bats, which transmits the Ebola virus to other animals and humans. There is no proof that mosquitoes or other insects can transmit the virus. Once infected, a virus can spread the virus to other people. The Ebola virus is not as contagious as common viruses such as colds or the flu. It is not spread through air, water, or food. The Ebola virus is spread through the direct contact with blood of a person infected with virus. Bloody fluids such as breast milk, stool, saliva, semen, sweat, urine, or vomit of a person infected with the virus. Objects such as needles or syringes that are contaminated with the virus. Animals such as bats and primates that are infected with the virus. Direct contact means that a person's eye, mouth, nose, or broken skin touches contaminated blood, fluids, or an object. Broken skin may be cut, scratched, scraped, or open wound. For most people, the risk of being infected with the Ebola virus is extremely low. The risk increases if you are traveled to an area where known EVD outbreaks have occurred. Help take care of someone infected with the virus. Have direct contact with a person infected with the virus. Even an infected dead body can still spread the virus. How is Ebola virus disease diagnosed? Tell your doctor about your symptoms and risk factors, for example, all recent travel. You must have symptoms of EVD and have a possible exposure to EVD in order to be diagnosed with it. Your doctor can do a blood test to confirm if you have been infected. If you are diagnosed with EVD, you will be put in an isolation right away to prevent the virus from spreading. Can Ebola virus disease be prevented or avoided? Currently, there is no vaccine to protect against the Ebola virus. However, scientists are working to 2 vaccines that may be available in the future. It is rare for people in the United States or other developing countries to get infected. You can help lower your risk in infection by doing the following. Avoid traveling areas to where the known EBD outbreaks have occurred. Do not touch the blood or body of fluids of a person who may be infected with the virus. Do not touch the body of a person who has died from EBD. Do not touch items that may be contaminated with the virus. People who work with healthcare settings should be extra cautious around those who are infected or at risk of being infected with the Ebola virus. Call your doctor right away if you are at increase of being infected and have symptoms of EVD. Avoid contact with other people until you get medical care. Ebola virus disease treatment. Currently, there is no medicine to treat EVD. Some experimental medicines are being tested. The main goal of treatment is to manage your symptoms. Options may include getting fluids to prevent dehydration, regulating and replacing salts and other chemicals in the body, maintaining blood pressure, taking medicine to relieve fever, diarrhea, nausea, and pain, getting oxygen, treating other infections. Close supervision care by healthcare professionals is very important. A patient with EBD may need intensive care unit ICU services. Living with the Ebola virus disease. Overall, EBD had death in about half of people who become infected. People who recover from EBD may still be contagious. The Ebola virus can remain in certain body fluids for some time. For example, men can spread the virus through the semen up to 3 months after the symptoms first appear. They should not have sex, including oral sex, during this time. The virus also can remain in breast milk, amniotic fluid, eye fluids, and spinal column fluid. Ebola virus have lasting side effects from the virus. These could include fatigue, muscle aches, stomach pain, and eye problems. Question to ask your doctor: how do I know if my symptoms are related to Ebola virus disease? How can I prevent getting infected? How can I prevent getting infected with the virus if I have to travel to a place known with EBD outbreaks? What treatment are the best for me? How long am I contagious with the virus? Once I have EBD, will I always have or I can get it again?